I am Dr. Lynne Chepulis and I'm Associate Professor at Te Huataki School of Health here at the University of Waikato. The research that I do sits at the intersection between chronic disease management, public health and health service delivery, and we specifically focus our efforts on understanding equity in diabetes management in primary health care. So diabetes is a chronic disease which affects approximately 300,000 people here in Aotearoa, New Zealand. We have approximately twice the rate of occurrence of diabetes for Māori, and they unfortunately have a rate of hospitalisations and comorbidities and complications of 5 to 6 times that of non-Māori. Some of the work we do, for example, partners with Māori health providers to provide support directly with patients and whānau, providing care in the community within their homes to help support their diabetes journeys. We've also been undertaking research to understand the impact of health system factors on diabetes management in primary health care. In this work, we've been looking at factors like the model of healthcare delivery, things like the cost structure, the fees, rural access and patient-doctor ratios, and how that impacts on diabetes outcomes. We've identified that Māori and Pacifica do have a much higher uptake now of these newly funded medications that have been recently approved by Pharmac. This was a game changer here in New Zealand in that Pharmac brought these out with ethnic prioritisation, and this is one of the key things we've been evaluating to understand whether we can reduce that health equity gap. We have extended primary healthcare teams going out into communities. We have kaiawhina who are addressing social and familial barriers to care, and we have marae-based clinics that are running to try and work with whānau and communities in more socially deprived areas. The other piece of work that we're doing is looking at education for clinicians, but the GPs also need to have the appropriate education wrapped around them so that they can provide the best information around medications and treatment for their patients.